University Hospital Birmingham is the leading teaching trust in the West Midlands. It covers the range of specialties that can be provided for any range of illnesses or diseases that people may present with. Nobody wants to be ill, but if you're going to be ill, this is the place to be. We have a fantastic new building that will be opening in 2010, state of the art, a brilliant design with the most up-to-date equipment and facilities that we can provide. The staff are clearly one of our most important assets. All we do in healthcare, everything we do, is reliant upon people. It's people looking after sick people, people caring for people who are worried, ill and distressed. So of course our staff are our most important feature in doing this.
It's not just about doctors and nurses. There's a lot more professionals within the organisation that, contribute to the end goal of patient care. At University Hospital Birmingham, the reason I chose to work as a general manager here is because of the opportunities available to me, the training, the education, the mentoring and the support.
In a hospital environment, it's absolutely vital that staff are motivated. Clearly we are dealing with people's health. Patients are coming in feeling anxious, and it's absolutely essential that staff are highly motivated and give that impression to patients. Staff are attracted to our hospital because we have a very strong reputation in terms of training and development, and we have close relationships with our two local universities. We have systems in relation to appraisal, a range of support mechanisms in relation to staff, whether it's opportunities for flexible working, occupational health services, access to staff support, and we have a range of facilities such as leisure facilities, access to creche on site, salary sacrifice schemes.
Been fostering now for about 10 years, and certainly when we first started it, I wasn't aware that I could be eligible for paternity leave under the adoption policy. But certainly when our first child came along, I had 2 weeks paternity leave. So that with the flexible working has been really helpful.
The success of the schemes is tested once a year through an annual staff survey that we do, which actually demonstrates year on year that our staff do feel very happy and are proud to work in our organisation. Each year we analyse the survey and we highlight where there are particular issues that we could do better on, and we talk to the staff and we look to put in measures as part of an action plan, and then we test that out the following year to see whether we've actually achieved success or not.
Exchanging are a private organisation who specialise in business processes, some outsourcing functions, and we went into partnership with them on the 4th of September last year to provide HR and payroll services. We have been making improvements in the payroll operations area by actually closely looking at our processes and workflows, and now recently having introduced technology to measure the actual performance within that area. The partnership with Exchanging has been operational now for almost a year. University Hospital Birmingham went through the NHS procurement process in selecting the right partner. There was a real partnership approach right from the start, and this has continued through to today.
I work as a consultant maxillofacial stroke head and neck cancer surgeon. Patients who come in after severe injuries to the face, or patients who've been treated surgically for cancer, I reconstruct them.
What we're doing here is this gentleman we're operating on has glands in the neck, and we don't know what the cause of the swollen glands are, and therefore what we're doing is trying to remove some of the glands so we can send it off to the pathology department and also the microbiology department to see whether we can assess what the cause of his swollen glands are.
I started working at the University Hospital Birmingham in February 2003, so it's just over 4 years, about 4.5 years. I have to say I was very nervous coming to work for a huge organisation like this. Despite being a big teaching hospital, all the dealings with all the staff are amazingly friendly, and people are very supportive.
From my perspective, I thought there wasn't anywhere for me to go, but certainly people here helped me to realise that there were much broader horizons. I've now branched out from my nursing background into HR and organisational development, so I think there are many avenues that can be explored here, even if you didn't originally think that they were there in the first place.
I'm a ward clerk on the surgical assessment unit, where I meet, transfer and discharge patients on the computer system. I request notes for the patients, and once they come off, I'll add documents into the actual original notes The trust motivates the members of staff by giving them training and courses which relate to their role and will progress their career further.
We're very lucky here that we've got fantastic staff who are very committed and dedicated to the job. We've got some of the best skilled people in the country, and people enjoy working here for the positive atmosphere and for the atmosphere of people always wanting to do better, always wanting to improve the services we give. That makes it a great place to work and to be, even though caring for sick people can often be quite distressing and quite stressful at times.